Thank you to Path Presenter for this slide of adenoid cystic carcinoma. So on this from low power, I see a well-rounded, very cellular entity surrounded by fibrous septae. These nests of cells surrounded by fibrous septae, there's a little bit of blood as well. Let's zoom in closer. So from intermediate power, I see kind of myxoid, mucinous kind of like stroma with kind of a cribiform architecture. What that means is kind of like cheese hole architecture, as you see in like Swiss cheese. As we delve closer, you can see the cells kind of arrange themselves around the mucinous stroma. And that's very typical of adenoid cystic carcinoma. It has this cribiform pattern, although it can have other patterns, including like a solid variant. So that's just something to keep in mind. I remember having a frozen and there was a solid variant of adenoid cystic, and it kind of looked like basal cell carcinoma. It didn't have these very structured holes, so just a pitfall. Luckily, we knew she had a history of adenoid and that it was solid variant, so that helped us. But your telltale sign, especially for boards, is this like well punched out structures, because a differential is basal cell carcinoma, which can have myxoid changes, but it won't be clear cut as this. In cytology, you'll see this kind of well-arranged arrangement of cells around the myxoid stroma, whereas in pleomorphic adenoma, which is a differential, these the myoepithelial cells will be embedded within the mucin. So molecular translocation, the most common molecular translocation for adenoid cystic is translocation 6-9, MIB, NFib. And I'm trying to look for perineural invasion, which is pretty common in adenoid cystic carcinoma. And thus can cause a lot of pain. I don't see it here, but it's often present. And in terms of where it arises, it can arise, the places I usually see it is in the salivary gland, but rarely you can see it in breast and lung as well. The breast is kind of like a modified salivary gland, and there are salivary gland elements in the lung, although those salivary gland tumors in the lung are very, very rare. So yeah, let me know if you have any questions, and I'll see you next time.